Welcome to TriArc Health's MIPS training for CMS measure number 2, depression screening and follow-up. This is a percentage-based measure of patients seen during 2022 who are 12 years and older who are screened for depression on the date of their encounter or up to 14 days prior using an age-appropriate standardized depression screening tool. And if positive, a follow-up plan is documented on the date of their encounter. CMS outlines a number of screening tools which could be utilized for this measure. In this demonstration, we're going to be utilizing the PHQ-9, which is built into QEMR screening tools. If you're interested in utilizing a different screening method, please reach out to our support department for assistance. The follow-up plan shown in this presentation will be a specialist referring the patient back to their PCP due to the positive screening. Additional follow-up plans such as pharmacological intervention and depression treatment is available for providers who treat the positive screenings. Please review our corresponding quick guide for more information on this. All right, let's get started. First, we'll start by opening the PHQ screening tool by clicking on Go, Screening Tools, PHQ-2 Survey from the main toolbar. From here, you'll enter the patient's responses for questions 1 and 2 and click Submit Survey. In this instance, the patient answered no for both questions, which CMS states is a negative screening and no follow-up care is required. When we click the Close button, it will return us back to the screen we were at when we opened the screening module. Next, we'll walk through the process of a positive screening. Again, we need to navigate to Go, Screening Tools, PHQ-2 Survey from the main toolbar. Now I'll answer yes to the first of the 2 questions and click Submit Survey. This automatically brings us to the remaining 9 questions. We'll answer the questions based on the patient's response and then scroll down to the bottom and click Submit Survey. The Survey Complete message appears, and now I'll click the Close Hot button, which will bring us back to the screen which we were at when the survey was opened. To increment the numerator, the provider must advise follow-up care for the positive depression screening. And in this presentation, the provider has recommended PCP follow-up for the positive screening, and it will be documented in the History module, which will open by clicking the History Hot button in the top toolbar. From here, we'll click on the Health Maintenance Screening category in the left sidebar. Then we'll click PCP Referral for Positive Depression Screening. This will add it to the patient's chart. Now we need to enter an occur date for today's date in order to get this item to increment the numerator. Note that the naming of the history category and the follow-up items are practice specified, so your history items may vary some. With that said, we can now click the Save and Close Hot button and we're done. There are a number of exclusions and exceptions built into this measure. 1 being patients who refuse to participate. 2, patients with a diagnosis of depression or bipolar disorder. Or 3, an existing medical reason such as cognitive, functional, or motivational limitations. Or the patient is in an urgent or emergent situation where time is of the essence. And finally, with any of our quality category dashboard measures, the patient exam must be properly coded with both an ICD-10 and CPT code. For more information on any of this, please see our corresponding quick guide or reach out to our support department. Thanks for taking the time to watch, and please reach out with any questions.